Hello everybody, my name is Jordan Mast. I am a PA at the Colorado Neurological Clinic here in sunny Denver. I've been in practice, general neurology practice, for about 12 years now, but one of my passions that I've developed over the years has been treating Alzheimer's patients. And in that last video, we really discussed about how do we make the diagnosis of Alzheimer's disease, but probably the most important conversation that comes after that is, well, what do we do with that information, right? We can make diagnoses in neurology, but it's important that we can take that information to improve patients' quality of life. And when we see patients in follow-up, let's say that we are making, we've made the formal diagnosis of Alzheimer's disease, we're having this difficult conversation. The exciting thing is, it's not, you have Alzheimer's, I'm so sorry, good luck. It's, here's what we're gonna do. And what I like to do is I like to have a whiteboard. I like to draw on there three things. Number one, lifestyle, talking about things like diet, exercise, things that we do every day in our clinics. Interestingly enough, social engagement outside the family especially is an incredibly important component of patients' life that really can improve their cognitive function and be neuroprotective. The second thing I like to talk about is this idea of symptomatic therapy. Symptomatic therapy is exactly what it sounds like. It's medications or treatments that focus on improving their symptoms, whether it be medications that we've all heard about like donepezil, memantine, or similar classes. Possibly if they have neuropsychiatric symptoms. I just had a conversation earlier today with one of my patients where there was quite a bit of depression, which is very, very understandable in these circumstances. Whether it be therapy or counseling, because obviously you have to be very careful in medicating these patients, or possibly putting them on an antidepressant, helping them with medications for sleep. But one of the most exciting advances that we've made in the last few years is this focus on DMTs. Disease-modifying therapies are not a novel concept in neurology. We've talked about DMTs for decades in the world of MS. But in Alzheimer's disease, there's only been medications that for disease-modifying therapies for Alzheimer's for the last couple of years. And the focus for the DMTs is to remove amyloid plaques, so we call them amyloid targeting therapies, through an intravenous administration. But importantly is to know when these therapies are used. They're used in the very early stages of Alzheimer's disease, in the mild cognitive impairment stage and the mild dementia stage, but also that there is potential risk associated with it. As we all know, medications have risk. But one of the biggest risks that we talk about with patients is a condition called ARIA, which stands for amyloid-related imaging abnormalities. And ARIA is something that we spend a lot of time talking about because there's risk of microhemorrhages and edema in the brain. It's a relatively low risk, but it's there. And so making sure patients are aware of this and what the risks of getting ARIA are will really help make them feel included in that conversation. So having the conversation about lifestyle, symptomatic, and disease-modifying therapies helps them understand that this is a very broad approach to treating them. Thank you for your time, and stay tuned for the next video.